Today I'm going to talk to you guys a little bit about health insurance and healthcare reform and the state of Texas, as you can see. Well, last week, as many of you know, the U.S. House of Representatives voted to repeal healthcare reform. And I think that was really indicative of a lot of the partisan craziness that has gone on in the whole debate about healthcare and health insurance since really this has ever been an issue in government. And that's really exemplified in the title of the act, which was the Repealing the Job-Killing Healthcare Law Act. And not only is that a tongue twister, but it really showcases the fear and the just confusion about what this healthcare law is really about. And lost in that shuffle and in those discussions is the fact that there really are people who are uninsured in our state and across our country. And here in Texas, we actually constitute about 10 to 12% of the uninsured in the country. So we really are a big part of the problem. So the U.S. uninsured rate has hovered about 15 to 16% since 1988. And during that same period in Texas, where we like to do things bigger, we've always been around 20% and higher. Currently, we are at 26% uninsured and over 6 million people uninsured. So we have the highest rate of uninsured in the nation and also the second highest number of uninsured people in a state. So those are two numbers that we really can't be that proud of as a state, and they're definitely at the forefront of our minds at Texas Impact. A little bit about health insurance in the past. While the idea of health insurance bounced around a lot, even in the late 1800s, in the early 1900s, the very first idea of sickness insurance began to float. And in the 1920s, some labor unions and health organizations began to issue the earliest forms of health insurance. So the private marketplace was there in place for some time, but then in 1965, President Johnson signed Medicaid and Medicare into effect. So we've had that we've had public health insurance since 1965. There are three main methods of getting health insurance. First of all, through your employer, if you have an employer who can sponsor health insurance. Secondly, through individually purchased coverage, which is often the most expensive form. And coverage through a public program like Medicaid, Medicare, or CHIP for children. Let's look a little bit at Texas's insurance market. Texas is known as having one of the healthiest commercial insurance markets in the country. The private market served about 1.5 million individuals in 2009. And despite our relatively high number of uninsured people, we actually have a pretty stable insurance market. But insurance carriers report billions of dollars in premiums sold in our state. So the problem isn't that there aren't health insurance carriers or health plans out there. It's not availability, it's affordability. Often people can't afford the premiums charged by the insurance companies. In the U.S., in 2004, so this is a little bit old of information, but a small business with fewer than 10 employees was charged a little bit under $4,000 for a premium for an employee. During that same time, a large business with over 50 employees was charged about $3.6 thousand. And so that's a difference of about $300 per employee if you're looking small business versus large business. And in that same year in Texas, a small business would be charged about $4,500, and a larger business, $3,600. So that's a much larger difference, almost $1,000 difference between a large or a small business. And over the past decade, the average premium costs have doubled in Texas. And the average premium for family coverage in Texas in 2009 was around $13,000, which is pretty high. The Texas State Comptroller made a statement in 2005, which I think is really important. She said that Texas must make health insurance more affordable and health care for the uninsured more cost-effective. This will require the cooperation of Texas businesses, communities, and local, state, and federal officials. Businesses, state and local governments, insurers, healthcare providers, and even consumers must work together to find innovative ways to meet the healthcare needs of Texans. At Texas Impact, we do a lot of working together with other organizations, and we sit on a few coalitions where we are trying to put that into practice. Well, let's talk a little bit about the uninsured in Texas. Despite what people may say and the pictures they may paint of people who don't have health insurance, there's really no one face of an uninsured person. And a summary of national data put out by the Congressional Budget Office shares some groups that have a high tendency to maybe be uninsured. So that includes family with an income below 200% of the poverty level, which this year is $44,000 for a family of 5. Now, remember when I said that the premium had jumped to $13,000? A family of 5 making $44,000 isn't going to be able to pay $13,000 for their health insurance. Hispanic individuals, young adults between the ages of 19 and 34, and this group is on here because, I guess, traditionally they might be making a lower income, and they might also feel invincible and be healthy, and so they won't buy into insurance. But this group has the highest uninsured rate at 32% of any age group. Also, households where adults work part-time or seasonally. In this situation, their employer probably isn't providing health insurance. People with low educational attainment, whether that means that they aren't working a job that is allowed to give them health insurance, or if they just aren't able, they don't realize that they need it. Or people making moderate or low wages for the similar reasons. Sadly, there are groups who are typically just higher at risk of being in poverty and more in need, and that tends to be minority groups. So if you look at the demographics for Medicaid, for public insurance, there are about 12.9% of Texans were on Medicaid last year. And if you break that down among demographic groups, 17.7% of blacks were on Medicaid, 19% of Hispanics, and 6% of whites were on. So it's much higher among minority groups. And then for the uninsured, as we already talked about, the 26% of Texans, among blacks and Hispanics, that percentage was nearly the same, 26%, but among whites it was much lower at 15.9%. So you see that there's a skew towards minority groups. I've talked a little bit about insurance through your employer. And Texas wasn't faring so well over the past few years for that either. In 2007, we were ranked 50th for employment-based health care. In 2007, 46.7% of Texas had coverage through their employer, which is less than half, sadly. And over 80% of Texas uninsured are in households in which one or more people work. So it's another myth buster. People who do work often cannot afford health insurance. This is especially bad in the small business marketplace because only 1/3 of firms employing less than 50 employees were able to offer health insurance, and only 1/3 of those employees were buying into the health insurance. So among small businesses, it has been difficult for employers and employees to feel financially secure to offer and purchase health insurance. So there are a few statements that I think are very true about building a stronger and better Texas, and that is that first, the economic vitality and security of Texas depends on the health of its population. If we have a sick population, people that aren't able to work, people whose children are sick and they aren't able to get them quick and proper care, people that aren't getting preventive care, well, we're not going to proceed quickly as a state. And the strength and productivity of the Texas workforce is critically linked to the health of workers. It's pretty self-explanatory. So let's talk a little bit about that healthcare reform. Obviously, there was a lot of controversy and debate surrounding that law, but it currently is law. It was signed back in March of last year, and since it was signed into law, a lot of the provisions have already been put in place. And the healthcare reform was structured so that it kind of has a snowball effect. A few things went into effect right away, a few things 6 months later, a few things beginning this January, a few weeks ago. So the provisions are already taking place in Texas, and I'm going to tell you a few stories that we were able to gather from one of our coalitions about people who have been affected by healthcare reform. So first is Matt, who had a 20-year-old son. He says, "My 20-year-old son, due to medical reasons, had to drop out of school last year. Therefore, he was dropped from my company medical insurance. I tried to get him covered under another program, but I was told he was ineligible for that program because he had dropped out of school one month before that program went into effect. So my only option was to cover him on a very expensive COBRA plan. Thank goodness I could afford the premiums. He is back in school now, but still part-time. I can't wait for my new insurance plan year to begin so I can cover him again on my policy since he's under 26. I've never understood the school or nothing policy of insurance companies. And just a note, Matt's plan year restarted, so he was able to put his son on his insurance. And then Jerry said, for some reason, my doctors and other healthcare professionals were not familiar with pre-existing conditions insurance plan that was passed by healthcare reform. And I kept telling them that it's already in place and it's a life-saving insurance plan. I was able to give some of them the information about it and they were grateful. My surgeon said that he had several patients who would benefit from this insurance. And for some reason, some people didn't think that it started until 2014. This insurance should not be so misunderstood. I feel threatened when they so callously state that this is job-killing insurance. If they took this away from me, I would have absolutely no chance to get any kind of treatment. I was first diagnosed with cancer in August 2009 and am just now starting the process to get treated. In that time, my cancer has evolved from dormant to aggressive, and I know I'm not the only one with a situation like this. And then thirdly, Jane says, I know I cannot fault the insurance company in any way or the medical professionals either, but the entire medical treatment process has just been a tragedy. American citizens are dying from lack of treatment and diagnosed too late to have any type of life-saving treatment. Jane was diagnosed with lymphoma in August and was still being working on treated in January of this year. And fortunately, she says, I have a slow-growing cancer, and other people are just not so lucky. No working American has enough money stockpiled to pay for private cancer treatment or any other catastrophic illness, and no one except the very, very wealthy or the very, very poor are afforded any treatment for a long-term illness. She says, I wonder about the quality of treatment that the very indigent receive, but I wonder even more about the treatment that the uninsured working American doesn't qualify to receive, and I wonder how people are being treated. So these three people all have seen healthcare reform work in their lives, and I'm going to give you a brief rundown of what's already been implemented. You have a list of this somewhere in your binder in one of your sheets, but we also have it on the Texas Impact website, and you can go to healthcare.gov, which is the best place to find out the newest and best information about healthcare reform. So first, free preventive care. This includes checkups and screenings. The Medicare Part D drug benefit coverage gap. There was historically a gap in payment for some Medicare enrollees, but drug prices under this are slowly being discounted, and last year, over 100,000 Texans received a one-time tax-free $250 rebate to help them pay for their prescription drugs. The extension of coverage for young adults, I've kind of already mentioned this, but this allows young adults to stay on their parents' plan up to the age of 26, and an estimated 161,000 Texan young adults should be able to stay on their parents' health insurance, so that's helpful for a lot of people. The small business healthcare tax credit will help a lot of small businesses offer insurance to their employees. The pre-existing condition insurance plan. There were approximately 700,000 medically uninsurable Texans, and while some might have been on the Texas high-risk pool, about 300, almost 400 uninsured Texans have enrolled in that plan already. The Consumer Assistance Program, we actually have the director of the Consumer Health Assistance Program here with us, and she's going to explain this in greater detail in a moment. And the rest of them, free preventive care for seniors, a Center for Medicare and Medicaid Innovation, the Community Care Transitions Program, which is a pilot to help lower the rate of hospital readmission for seniors. Medical loss ratio, just ensuring that insurance companies are spending a sizable amount of their premium dollars on consumers. Premium rate review, which gives a grant to give states the opportunity to look into why premiums jump. And also strengthening Medicare Advantage, which is a program of Medicare. I'm going to show you guys a few of the anti-health reform bills that have been filed already in Texas. Most of these bills are superseded by the national law that went into effect. So, but you can be aware of them, and it's something to note. The first three bills would impose penalties for participating in healthcare reform: HB 97, HB 297, and HB 335. The next bill expresses opposition to healthcare reform, and then those last two would institute constitutional amendments against healthcare reform in Texas. But there's a great bill that we're very excited about, and that's the exchange bill that was filed very recently. It's HB 636, and it creates a Texas healthcare connector. This was filed by one of the leading Republicans in the Texas House, and nationally, as you may know, you've heard of the exchange. That would be implemented in 2014 across the nation. And as I was thinking about how to explain or talk about the exchange, that word is just, you may think stock market exchange, what does that even mean? But it's basically similar to an old-fashioned telephone switchboard operator, like the person who would connect you when you made a phone call, the person who directs you to the right person, plugs you in to who you want to talk to. And that's the point of an exchange, basically giving you the insurance that you need, the rate that you can afford, and helping you connect. So interestingly enough, Representative Zerwas is not particularly a fan of the healthcare reform bill in general, but he could see the need in our state for strengthening the Texas health insurance market and making a fair playing field for Texas consumers. Texas has to act at this legislative session, in order to lay the groundwork for an exchange. So he says that this exchange will provide a unified marketplace for consumers to compare and to purchase health insurance in the state from private providers. Zerwas believes that this will uniquely benefit Texas, and he described the exchange system he's proposed as a public and private partnership, and it's modeled kind of a compromise between some other states and what they've been doing, with a little bit of Texas flavor thrown in. He said it builds on some of our experience in our state, and he's taken pieces of things that seem to work well in Texas and moved them into what this exchange could be. And so he thinks the idea is a good one for Texas, and so do we. So although Texas is not always seen as a leader, we're at the bottom of many lists of things in this country, which is unfortunate. But we've proven ourselves to be good at market-based innovations in some markets, and the ones that we care about especially. And nationally, it's seen that Texas is really the only state that has established a successful deregulated market where people get electricity. And so Texas really does like markets, and we are willing to put effort into the ones we care about. The Public Utility Commission of Texas and the Electric Reliability Council of Texas, PUC and ERCOT, are the things that manage our electricity. And their mission statements say things like protecting customers, fostering competition, and promoting high-quality infrastructure. And ERCOT itself is a quasi-governmental agency, but it's also a nonprofit, and it manages the flow, addresses people with various income needs, and makes sure there's an adequate supply of electricity across the state. These are things exactly what we would need a health connector to do, or a health exchange provider to do, to manage the flow of it, address people with various income needs, and ensure the availability of healthcare to people across the state. So there are a few ways that Texas has been leading the nation with this kind of market structure, and we think that Texas could take that kind of market structure and apply it back to health insurance in order to help things run smoothly. As I mentioned before, we are a member of many different coalitions on the budget, on health, and those kind of go together, but one that we're a member of is Cover Texas Now, which is a coalition of faith-based groups and consumer groups. This coalition recognizes that Texas has a great opportunity right now to step up and join healthcare reform and not be afraid of it, and not join in the partisan rhetoric that's making, it's just not productive right now. We think that since health reform has already been implemented, and that we as a state have a lot to gain because we have such a high uninsured population, that Texas should make the most of the new law, help the families that are struggling with the cost of health insurance, bring back home the federal tax dollars that we're already paying, and reduce our 6.4 million uninsured people across the state. So we want quality health insurance available for every Texan, and we're asking lawmakers to do a few things. First of all, create a sustainable health insurance system, and one that lasts, one that really works, not the one that we have now that's quasi-broken because we have over a fourth of the people in our state uninsured. We want them to preserve CHIP and Medicaid, improve small businesses' access to affordable health insurance, which would allow a lot of people to be on health insurance through their employer. And there are many small businesses in Texas, so this is really important. Also, establish common sense protections for Texas consumers and write it in statute, have that in law, and provide transparent, open systems that meet consumers' needs. So as you're going to your legislative visits, here are the goals that we really have about health insurance this session. We're asking legislators to start building a strong health insurance exchange to help families and small businesses get affordable insurance beginning in 2014 when the exchange is implemented. So Representative Zerwas is already on that train, and we can ask people to join him. We want to make sure the Texas Department of Insurance can enforce the popular insurance reforms like no pre-existing denials for children and keeping your children on your policy until they're age 26, making sure rate hikes and premiums are fair. And we really think that it's important to give state agencies and the exchange, when it's created, the authority and the tools to build consumer-friendly systems for enrolling in coverage so that people aren't confused by the whole insurance system and they understand and are given a platform to register for what they need. So as I've shared before, the U.S. Uninsured system or problem is really a big Texas problem. Being one of the biggest states, we are constituting a large share of the problem. And so I think it's important for us to really encourage our lawmakers to stop the rhetoric and the back and forth, the angry talk, and really address the problem. We have 6.4 million people uninsured in our state. We have a lot of tools for fixing our problems, and we have a chance to get things right now. And this is really a time to try to have a health insurance market that works.